also ensuring the other aspects because it's a passive mobilization finally. So you will not want the patient to be actively performing. Barring certain types of mobilizations, that is in Mulligan, there is an active component that is involved. So when we talk about Mulligan, we'll be discussing about all this. But most of the mobilizations that we are currently discussing about are those wherein you are bringing about a movement onto the patient rather than the patient doing anything, right? And that's where the other principles of support and relaxation also should be very meticulously followed. Okay. The other aspect also that you should remember is that when your hand placement is bringing about some pain, because some patients might also be tender. So in that case, ensure that you are able to change your hand placement accordingly or use a foam padding so that it causes some pressure distribution. Okay, so because the force that is going to be applied, if it is generated proximally, still it needs to be transmitted through your hand placement or your finger placement, isn't it? So in that case, avoid that and then use something or some such procedure with which you can disperse the pressure, okay, and not cause the patient any more discomfort. Are you all clear with this? Are you? So,
Yes, ma'am.
okay, fine, fine. So then we will go on to the next aspect, that is NP. It's a very, very important concept in manual therapy and even otherwise. We have touched upon this when we did the musculoskeletal assessment, right? So does anyone remember what we discussed about NPs back then? Anyone who wants to work? Yes, Sakshi. Yes.
Sensation experienced by the therapist at the end of the passive movement.
Correct, correct. Each and every component of this definition is extremely important. It is a sensation, okay? And how is it that you will sense something when there is a physical contact? Just a second. Only when there is a physical contact between the patient and you, right? So that is why you cannot really be telling the patient to carry out that movement. Many times students land up performing only an active range of motion assessment for whatever reason. See, active range of motion assessment does have its importance. I'm not denying it. It still tells you about the willingness of the patient, the cooperation of the patient, the ease with which they are performing the movement. It gives you a judgment about how much range of motion is available at the joint because you know that passive would always be slightly better than that. Okay. But beyond that, if you are wanting to know what is it that is restricting the range of motion, you have to perform the movement passively because active, the extent to which the patient can perform the movement is greatly determined by how much strength they have. Right? So if there is a muscle tendon pathology, then it is definitely likely that their active range of motion would be limited to a great extent. Right? So in such a case, you want to resort to some more information that is derived from the passive range of motion assessment. And here is where our NPL comes into picture. So it has to be passively performed, and only when you are placing your hand directly on the surfaces that are moving, will you experience that sensation. Okay? And that is why very important thing is all of you do it more often on your patients. We haven't done a lot of practical here because when we did musculoskeletal assessment, we were doing more so from the theoretical point of view. And now that again you all are back home and there aren't much presentations that are occurring, it would be a little difficult for